Hello everybody and welcome back to Pineal Gland Cystic Brain Tumor and Mental Health Awareness Program. My name is Lasha Barbosa. Thank you for joining me today. I give a big thank you to all my friends and my family and complete strangers who have donated on my GoFundMe page towards my upcoming brain surgery in Houston, Texas this May. Thank you so much for all of your generosity. This brain surgery is being made possible because of you guys and your support. As many of you have noticed, because of my last video I posted, my husband and I are dealing with some issues in getting possession of his house back, and it really has impeded our life. And it's really made my brain tumor much worse and my sickness much worse. So I have stepped back and I haven't been making as many videos, but I have not forgotten about this campaign. And I am working hard at getting those t-shirts out this coming year still, hopefully before I go in for surgery in May. And if not, they're still coming out even after my surgery. Today's video is on Dr. Patel. Many of you have heard of Dr. Patel, especially if you have a pineal gland cystic brain tumor. Dr. Patel is on our pineal gland cystic brain tumor Facebook support page, and he is instrumental in answering many questions for us, looking at our MRIs, as well as giving us consultations. If you haven't heard of Dr. Patel is a neurosurgeon, and he is also based out of Charleston, South Carolina. I reached out to Dr. Patel over a private message on Facebook, and I asked him if he wouldn't mind providing me with some information on what he notices as a neurosurgeon when it comes to this rare brain tumor, what he notices in his patients. And this is what he provided me. Pineal cysts have been noticed in many folks getting brain MRIs for many, many years, always thought to be asymptomatic. However, many patients with larger cysts and no other cause for their symptoms have had theirs removed, and many have gotten better. This has been my experience and that of other few neurosurgeons around the world. The symptoms are not the typical for pineal tumors, hence the lack of acceptance among neurosurgeons who see these patients. My view, Dr. Patel's view, having removed many, and when he says many, he's referring to the brain tumor, most of these have turned out to be pineocytoma. It's a benign tumor. The explanation, hypothetically, is what he believes the cystic tumor is exerting pressure on the tectum of the midbrain, and hence the visual symptoms that so many of us encounter and complain about. Plus, the cyst does communicate with the third ventricle. So I believe the fluid in the cyst, which is abnormal fluid, tumor secretions, is affecting the adjacent structures of the third ventricle. Hence, all the other seemingly odd symptoms, such as speech, sleep, cognitive problems, memory, motor, and sensory issues. The effect in the cerebral spinal fluid, albeit slight, is enough to cause headaches and an array of other symptoms that he has heard of from these patients. So Dr. Patel goes on to say, so when patients present with these seemingly odd symptoms and have no other cause for them, and they have a cystic lesion of the pineal, and the patients are really functionally affected, he believes and recommends removal of the cyst. I have been researching the pineal gland cystic brain tumor since I was diagnosed back in January 2017 with my brain tumor. And I have found a few neurological reports that I'm going to paste on my description down below. So feel free to click on the link below and you can read it for yourself. And one of them is from the US National Library of Medicine, the National Institute of Health. And it talks about an autopsy case of a sudden unexpected death due to a glial cyst of the pineal gland. So what it goes on to say in short form is that pineal gland cysts are usually asymptomatic, which is what many of us know and have been told by many of our neurosurgeons. However, it goes on to say, however, they may rarely cause symptoms such as chronic headaches, paroxysmal headaches with gaze paresis, postural syncope, a loss of consciousness, and sudden death. It goes on to talk about a 30-year-old woman with no specific medical history except for chronic headaches, and she was found collapsed in a public toilet. That's where they found her dead. When they did the post-mortem examination of this woman's body, it revealed no external injuries or internal diseases except for one pineal gland cystic lesion. Histological examination showed an internal cyst surrounded by glial tissue and pineal parenchyma. Pardon me if I said that wrong. But that was diagnosed as the cyst for the pineal gland. Although the pineal cyst cannot be confirmed as the cause of death, it was considered as no other cause was evident. Herein, a report, a pineal cyst was considered an assumed cause of death. Pineal gland cystic brain tumors have been brushed under the rug for long enough. You are finding your voice. So many of you are standing up and making your own YouTube videos. I'm so proud of you guys. This campaign is growing so large. It's going global, and a difference is coming. Thank you for watching my video today. I urge you to please share my video. Talk to your friends, talk to your family. If you're speaking to a stranger and you need something to talk about, bring up this rare brain tumor and ask them what they think. Let's raise awareness. Let's bring this up to insurance companies, to government bodies, to medical systems. Let's implement change. So many people are suffering and are in pain, and their lives are ruined every day because of this. I know. I'm one of them. And every day is a struggle. And every day is hard. And every day you just want to be better so you can go back to your normal life. I get it. And that's why I'm urging you guys. And that's why I thank you guys for liking my videos and for sharing them with your friends and your family and complete strangers. I love you all. I look forward to talking to you on Facebook again soon. And please comment on my YouTube video if there's something you want to see, if there's a story you want to share, if there's anything. Give me a comment down below. I love to hear from you guys.